Good morning and Assalamualaikum, I beg the honourable panel of judges, the loyal timekeeper, the symposium committee and also fellow audience. My name is Haressa Binti Hazudin and together with me will be my partner, Muhammad Azim. And this morning we will be presenting to all of you our research entitled Knowledge and Perception regarding oral hygiene instructions and periodontal education among dental undergraduates of UiTM. First and foremost, I would like to begin this presentation with a little introduction regarding this study. So the primary etiology for periodontal diseases such as gingivitis and periodontitis is the accumulation of plaque and calculus, usually caused by poor oral hygiene practice, namely improper toothbrushing technique, failure to carry out interdental cleaning, and irregular dental visits. Now, problems may arise when some periodontal patients are not able to understand that their periodontal health status also depends on their own ability and willingness in terms of oral hygiene maintenance at home and not just the dentist's treatment here in the clinic. So here in UiTM, in order to ensure patients who seek treatment with our students are able to understand oral hygiene instructions clearly, it is vital for our students to be well informed and equipped with correct oral hygiene instructions and periodontal knowledge, and for them to perceive the importance of OHIPE in periodontal treatments. Now I would like to pass the presentation to my partner.
Okay, thank you, Haressa. So I'll continue with the objective of this research. This study was aimed to evaluate the level of knowledge and perception of oral hygiene instruction and periodontal education (OHIPE) among the Year 4 and Year 5 dental undergraduate students of UiTM. So how did we achieve the objective of research? We look at our method. In this cross-sectional study, we utilized convenient sampling technique to select a sample size of 134 participants. A self-administered questionnaire was divided into 4 respective sections, which are A. Demographic information, B. Periodontal knowledge, C. Perception, and D. for opinion on OHIPE. A total knowledge score was calculated in section B from 14 periodontal knowledge questions and graded as either good, fair, or poor grade. Descriptive statistics were calculated for both section B and C by using frequencies and percentages, while chi-square test was used to assess the associations between the variables. So we look at our results. In figure 1, the demographic information of the participants are presented. So Year 4 is the blue color, while the Year 5 is the red color. Year 4 consists of 56 participants, which are 5 male and 51 female, while for Year 5 consists of 78 participants, which are 15 male and 63 female. Okay, so we look at our figure 2. So in figure 2 shows the distribution of periodontal knowledge among the Year 4 and Year 5 students. So Year 4 is the blue color and Year 5 is the red color. So Year 5 students were better in terms of answering correctly for almost all questions, except for question 11 and question 14, which are regarding periodontal patients can use the same size of interdental brush, and for question 14 regarding compliant patient should not have a plaque score of more than 25%. All of the participants knew that untreated periodontal disease will progress further as stated in question 5. However, majority of the participants did not know the best time to recommend and provide interdental brush for the periodontal patients as indicated in question 9. So association between Year 4 and Year 5 with knowledge score grade is shown below in figure 3. So 51.3% equivalent to 40 students of Year 5 scored good grade, while only 21.4% equivalent to 12 students of Year 4 scored good grade. So good grade is shown by 11 to 14 score. The p-value is less than 0.01 indicated by the Fisher's insect test, shows a significant differences between both years Year 4 and Year 5. So continuing with section C, the 5-point Likert scale was used to evaluate the participants' perception regarding OHIPE, and the data is presented below. So below shows the results of the 6 questions for both Year 4 and Year 5. The bar chart indicates that the response on each of the 6 questions were almost quite similar. Majority of the Year 4 and Year 5 responded by agree points for almost all questions, such as regarding giving proper information to your parental patients regarding their parental status in question 1, or in question 2 on how to improve their brushing technique, or even in question 3 regarding cleaning their interdental areas of teeth. Except for question 4, whereby Year 5 mostly scored strongly agree points on question regarding do you think the OHI book is helpful during OHI PE. So moving on with section D, it is regarding information, participants' opinion on OHI PE, and recorded as follows. A large amount of participants agreed on using videos or other audio-visual materials during the OHI PE session instead of using the normal method, which is by the periodontal educational book, as being done by the previous batches. Majority of the participants also suggested to include the patient's own periodontal charting and the OPG radiograph during the OHI PE session for the patient's better understanding of their periodontal condition itself. Now continue back with Haressa.
Thank you, Azim. Moving on to discussion. Several deductions can be discussed from the data that we have received from the questionnaire. Number 1, fortunately, participants from both years of study are able to understand that plaque accumulation is the main etiology for periodontal diseases, and they are also able to acknowledge that periodontal diseases may worsen if it is left untreated. However, a fair amount of the participants failed to understand that OHIPE should not be standardized to all patients. Instead, OHIPE that is given to the patient should be tailored according to each patient's necessity. This will strengthen the patient's understanding towards the OHIPE because the OHIPE that is given to them is related to their condition only. Number 2, majority of the participants answered that interdental brushes should be recommended and provided to the patient during OHIPE. Unfortunately, this answer is incorrect. Interdental brushes should only be provided to the patient once supragingival plaque and calculus is removed and the exact interdental spaces can be seen. This is to ensure that the operator is able to recommend the correct interdental brush size to the patient to guarantee effective interdental cleaning. Next, fortunately, majority of the participants understand the importance of multiple sizes of interdental brushes that are available in the market today, and they are aware that a patient may require more than one size of interdental brush. And participants were also able to prove their understanding that a compliant patient with good OHIPE understanding and efficient oral hygiene practice would be able to maintain good oral hygiene with a plaque score that is less than 25%. Moving on to the perception aspect, participants answered all questions almost similar to each other, except there was a statistically significant difference between these two groups of studies regarding giving information about patients' periodontal status and also advice regarding interdental cleaning. As for opinions, most of the participants suggested to incorporate audio and visual materials during OHIPE to attract the patient's attention and to also include the patient's own periodontal charting and panoramic radiograph in order to enhance their understanding. We have reached the last part of the presentation today, which is the conclusion. So from this study, we can say that Year 5 students achieved a higher periodontal knowledge score as compared to Year 4 students. And this could be due to their more clinical experience in dealing with periodontal patients as compared to Year 4 students. And for perception regarding OHIPE, it was almost similar among all participants from both years of study, generally because all of these participants have been taught the same periodontal module and periodontal curriculum. We can say that this study highlights the importance for students to be proficient with oral hygiene instructions and periodontal education as future clinicians. That is all from us. Thank you.